Okay, I'll start. I'm very conscious of time. We've just got an hour for this sort of webinar. But I just wanted to say, first of all, a warm welcome to everybody, and a warm welcome to what is the first Nursing Midwifery Green Week. And obviously, there is stuff happening nationally, but we are here from the Southeast to showcase all the fantastic work and achievements that we're doing. We've got a basically a Southeast webinar each day this week, and today we've got a theme of population health. Tomorrow is the nursing care pathways. Then on Wednesday we've got a focus on children and young people. And then day 4, innovation in healthcare. And then the final day on Friday is around clinical leadership. And we're also doing an award ceremony as well, which I'm very much looking forward to. I'm chairing today and Wednesday and Friday, and my regional chief midwife, Kay Wilson, is chairing tomorrow and Thursday. And we're very much looking forward to it. So we've got an action-packed, jam-packed agenda for today. Lots to get in, but I'm very much looking forward to hearing Imogen Stringer and Val Wilson. They're going to be kicking off our session, showing a little bit more detail about the collaboration between the Greener NHS and also the Nursing Directorate, including joint efforts between the sustainability teams and the IPC collaborative piece as well. We've then got Duncan Burton, who's Deputy Chief Nurse for England, going to be talking to us about the important role of nurses and midwives in population health. And then Dr. Malcolm White is also going to be presenting, who's a clean air specialist on the Global Action Plan for Air Pollution and how healthcare staff can help obviously prevent that. So before we go on into those presentations, I think it's really important just to give a little bit of context here. I mean, it's hugely exciting that we've got this week and we've got a real focus on this green agenda, because it's hugely important, and there has been lots of good work that's been going on. But to give this real context, you know, the NHS contributes around 5% of the UK carbon emissions. So, you know, quite significant actually. But there has been lots of good work that's been taking place, and in 2022 all trusts and ICSs created and published their own green plans that details the actions that they're taking at a local level. We also, in the latest annual report, it did show that we were slightly ahead, which is good, of predicted targets to reduce carbon emissions. And also, there's plans in place for the NHS, because it has the largest fleet, car and van fleet. Well, not after the Royal Mail. The Royal Mail's clearly got the highest, but we're not far behind that. And there's a big plan for our vehicles to be going to that electric, obviously, focus. So that's a really good initiative that's in play. And then if you look at our global supply chain, well, that accounts for 60% of the NHS emissions. So there's a lot of work again going on to really bring that down and to have that net zero commitment. And the NHS has pledged a net zero commitment. So this is all really huge focus on what our part that we're playing into the national agenda. But as I said, there's lots of good stuff taking place. In particular, within the Southeast region, there's lots of good stuff taking place. This is what this week is all about. It's showcasing the good work that's happening and bringing in some of our national colleagues as well to talk around that. But it's really important for us to have that commitment, for those that are attending these webinars, to come away to say, actually, where do you want to make a difference within your own areas and at a local level as well. So really excited to be hearing all of that. And also, this is a real supportive piece as well, and a collaborative bit, and it's all of us coming together around this agenda and making a difference as well. I want to say a huge thanks before we go into the presentation for Lucy Planner, and also for Kate Townsend, who have been, and the team as well, that's been wrapped around all of the planning for this week. Leanne too. You know, I know there's lots been going on, but you know, absolutely brilliant what we've got lined up. So very excited. Alrighty, so without further ado, shall we start with our first presentation? And again, I'm delighted to welcome Imogen and Val on your presentation. So without further ado, I'll hand over to you guys. If you just want to introduce yourselves as well, that'd be fabulous. So thank you.
Hello, thank you so much for that lovely welcome. I'm Imogen Stringer. I'm a registered nurse by background, predominantly in critical care, but I have been one of the Chief Sustainability Officer Fellows for the last year. Val, did you want to introduce yourself?
Okay, thank you very much. It's lovely to be here. So I'm Val Weston. I'm one of the nurse consultants in the IPC national team for NHS England, and it's lovely to be here.
Thank you. So Val and I are here today to talk to you a little bit about our infection prevention control, which I'm going to refer to as IPC, and sustainability collaborative that's been going on. So next slide, please. So first of all, I just wanted to highlight some of the links between IPC and sustainability and why this collaborative has been formed. So as you can see with this really lovely demographic from the Lancet report and the impact of climate change on human health. And I think it's a really nice diagram there, which really highlights some of the implications of things like air pollution and increasing allergens and water quality impacts, for example, of what that then impacts on our health and what we're seeing more and more in our populations that are coming into our healthcare services. So sustainable practices in infection prevention are really quite interconnected in several ways, as this diagram sort of illustrates slightly. And the understanding of these connections is getting more and more crucial for us to be able to address not only the sort of public health challenges we're going to see in the patients that we look after, but the environmental challenges too. So as from this diagram, it highlights that climate change, with the increase of climate change, our IPC, we could see an increase of vector-borne and waterborne diseases, respiratory infections, especially in our paediatric group. We're seeing more and more of that already over the last few years, especially. The likelihood of extreme weather events, malnutrition and immune function, and antibacterial resistance in our vulnerable populations. So there's some really key themes, even just from this diagram, which sort of shows the very high level impacts, but it really shows sort of the emphasis on it. It affects us all. And there's a real misconception out there that IPC practices can sometimes be a barrier to implementing some of our sustainable practices in healthcare. And that was one of the reasons that Val and I have been working very closely together to try and bring the groups together to try and unpick some of these misconceptions. And a more integrated approach amongst the two teams to recognise sort of the interconnectedness and the relationship between sustainability and IPC will really maximise the benefits of both. So it's more crucial than ever that we protect our human health, but also our planet. Next slide, please. And this is in relation to what might be coming out in our chief nursing strategy. So we know that one of the 7 Ps that's soon to be released, the first P is protecting our planet. So we need to be real champions for sustainability and advocating those most impacted by climate change. But you can see, although we've got the first P is protecting our planet, you can see where infection prevention, control and sustainability sort of feeds through the rest of the Ps. For example, prevention, protection, promotion and reducing health inequalities, person-centred practice and keeping people safe with quality improvement fits into all the threads of what IPC and sustainability teams do on a daily basis and how more we can work together. Next slide, please. As part of part of my fellowship, I've been part of the Chief Nursing Office with the Sustainability team led by Charlotte McCardle's portfolio. And part of the sustainability vision, I know there's quite a lot on this slide, but there's a brief synopsis that the vision of the team is to get nurses and midwives to protect the health of people, families and communities by the natural environment by championing sustainability, promoting health equity and advocating for people most impacted and delivering evidence-based net zero health and social care. And there's been a few different strands as to how we've been doing that. Mainly by maximising the strategic systems and the contribution of nursing midwifery to improve population health outcomes and delivering the net zero ambition, amplifying the impact of what nurses and midwives already do in decarbonising clinical pathways, because the contribution that they've already contributed is exemplary. It's amazing what's already been done, but I know there's still more to do. but also growing the capacity of nurses and midwives, and also enabling people to develop networks and expand the scope of influence and practice they have to help us deliver best quality care, but also lower carbon care. Next slide, please. And some of the ways that we've been doing that has been doing exemplar programmes, which I will touch on slightly later. But as you can see, IPC was one of the first topics amongst, you can see that cannulation and wound care. These are also quite prevalent topics within IPC, but these are some of the strands that we have been focusing on as a national sustainability nursing and midwifery team. And we've been trying to create a bit of a repository, best practice guidelines and things like that to try and help tie in and really illustrate some of the things we can do to bring IPC and sustainability teams closer together to improve our IPC and sustainability practices. Next slide, please. I think I now hand over to Val, so I'll let you take the floor.
No, that's fine. So obviously the Chief Nursing Officer Sustainability and IPC aims. So when we were looking at this, it was actually Imogen and I were having the conversation about how do we want to take this forward. So we looked at whether we wanted to bring together an IPC and sustainability leadership collaborative, and this was about bringing our IPC regional leads and our sustainability leads together, and to actually have this collaborative of ideas and how we can take things forward. So we're also in the process at the moment of developing a collaborative statement, and this will sit with IPC guidelines as we go forward and be part and parcel of the strategic action plan that we're looking at. We want to develop that repository of best IPC sustainability practice. And one of the things that came out of our first meeting was actually the work that's already happening out there. And as Andrea alluded to, we are all doing stuff. It's actually about bringing it all together and to actually share what we have been doing going forward. And there is a view that we want to scale that and spread it across healthcare, make sure that we are looking at what is out there already and these great ideas that people have. We want to incorporate sustainability as part of the language of IPC. So as we go forward, when we're looking at National Infection Control Manual, sustainability is part and parcel of what we do. And to look at all the different pieces of work that we have and guidance that we have and how we can sort of not just have a section on sustainability, but actually to embed that language as part of what we do as we go forward. And we're going to touch on this a bit later, or Imogen's going to touch on it, but we're looking at these exemplar sites, areas where actually we're looking at what we can do going forward, and to see how it works and what the impact of it is. So not only have we want to look at existing sites, but we want new exemplar sites so that we can adopt this across the whole of our system. Next slide, please. So where we are at the moment is our progress so far is we've had our first meeting of our leads, and that was on the 7th of February. And what we did was we did a bit of a workshop on exactly where we wanted to be and what we wanted to look at in the next 12 months, then looking a bit further ahead to 1 to 3 years, and then looking even further ahead on actually what we want to do in the future. We also drafted a collaborative and we shared that with the group, and members of the group were asked to submit their comments. We have a further meeting going ahead on the 27th of March. What we want to do is finalise that collaborative statement, so we've got something solid there that we can use. We want to look at and we've drawn together all those themes from these, the dates. So we want to have a look at them and then look at how we're going to be able to deliver this, because it's okay saying it, but we want to be able to deliver it and how we're going to be able to deliver it. And we also want to progress the introduction of that consistent sustainability language in all our IPC documents going forward. And now I'm going to hand back over to Imogen, who'll tell you all about the exemplar sites.
Thanks, Val. Next slide, please. So one of our ideas was to, as Val's described, is have the exemplar sites where we can really focus on some quality improvement projects that have a really sustainability and IPC focus. And that might be through reduction of high frequency products such as PPE, gloves, and cannulas. So some of the direct outcomes of this have been, so the local direct outcomes of having the exemplar sites is one, that we can get a real quick snapshot of some of the quantifiable carbon and cost savings that we can make through having SASQI projects like this running, but also a collation of IPC and sustainability best practice principles so that we can help with the scale and spread and implementation of similar SASQI projects in other areas. Some of the indirect outcomes from that have not only been the quantifiable sort of carbon and cost savings, but also the wider cost savings that we've actually seen an improvement in patient safety and reduction of infections through cross-contamination due to improved hand hygiene through some of the gloves off campaigns that have been running, for example. So we've actually been able to see a quantifiable saving in reduction of requirement of less care of these people in the exemplar site, which has been brilliant to see. And then we've got our sort of one of the things that we've really enjoyed seeing is the organisation and system outcomes, whereas as part of the collaboration of IPC and sustainability teams in this local exemplar site, they've been able to really find different ways how they can organisationally communicate with each other throughout these SASQI projects to implement best practice principles and sort of start changing the culture and behaviours of how they communicate to help make these changes last and address the sort of the strategic outcomes, which I've mentioned just previously. So next slide, please, and it shows some of the exemplar site work that we've been doing in the southwest. So Great Western Hospital was one of the first exemplar sites, and they were running 4 main projects which had the real IPC and sustainability SASQI projects, which was gloves off in critical care and then onto A&E. They also began their green ED accreditation of reducing cannulas, reusable tourniquets, and then piloting some reusable theatre caps. Those are the 4 main projects, but there was many other projects that were also captured, such as removing couch roll, sort of changes to linen and routine sheet changing, reusable gowns, and the bed to bedside, the waste reduction project, which is bag to bedside initiative. So that the Great Western Hospital has been running lots of different projects, which we've been able to capture some amazing learning, not only as sort of the carbon cost savings and the improved patient care, but also some of those organisational changes and behavioural changes that have been able to make these projects last. Next slide, please. Oh, okay, and that brings us to the end of it. So if we have time, I think we're just in our time slot, so apologies if we run over, but if there are any questions for Val and I, please do.
Well, I was going to, if it's okay, we've got the last 10 minutes of the hour we're going to dedicate to questions, so we'll go through the presentation. But thank you so much, Kate and Val. That was absolutely really insightful. There's been lots of good chatter happening in the chat, so thank you for those. Keep those coming. If you've got any questions actually that we can answer as we go through the presentations, do put those in. But we have the last 10 minutes, we will have time for questions. So brilliant. I think that sets us off on the right tone. All I would say as an IPC nurse myself, IPC has been flying the flag on this agenda, hasn't it, for quite some time. So it's absolutely brilliant to see those initiatives that have obviously come to fruition. I think the key thing for me is taking that learning, isn't it, and it's spreading this at pace, isn't it? So going further, faster, really. But some brilliant it's really insightful and some really good ideas there. So thank you. Okay, shall we move on? For those who've come in since we started, just to say I'm chairing this meeting. I'm Andrea Lewis. I'm Regional Chief Nurse for the South East, just so people know who who I am. But without further ado, now it's over to our Deputy Chief Nurse for England, Duncan Burton, who is going to take us through as to the role that nurses and midwives can play in population health, or anything else you want to talk about, Duncan. I really don't mind. The floor is yours. The floor is yours.
There's a invitation for,
I know.
you know. Okay, well, I will
warm
give
welcome.
you
Warm welcome to you. Thank you.
No problem at all. I'll give you my random thoughts as I go through the presentation. Nice to be with Team Southeast. I used to do Andrea's job, so Team Southeast always has a special place in my heart and the work that you do. So thank you, and great presentation from the IPC leads as well, because IPC is also close to my heart, as one of the responsibilities I have nationally is the national IPC team, working with Lisa Ritchie and others. And I also look after the maternity and neonatal transformation program, the children and young people's transformation program, and some of the nursing workforce projects, so the international nurse recruitment program, etc. And I'm going to talk a little bit about just some reflections on each of those bits, actually, of my portfolio, because they really impact and really talk to why the work around climate change, the work around sustainability, the work around population health and prevention is really critical for us. So if we move on to the next slide, I think we can't start a presentation involving nurses without a obligatory Florence Nightingale quote. And I've chosen this one primarily because actually this is in many ways how I feel about this. This is it's great that you're running these sessions this week. This is something we need to talk much more about with our nursing and midwifery colleagues. And we need to educate ourselves in. We need to educate ourselves more in sustainability, in climate change, the impact on health and health inequalities and population health. This is something that I've been learning throughout my career. I wouldn't say it's a finished product at all. And you know, I've been taking steps actually to educate myself in climate change over the last year or so, because I can see that this is such a significant issue and will have and is having such an impact on population health, both locally but globally, and certainly experiences of conversations with global leaders where they're already seeing this. But also I put a Florence Nightingale quote up because actually this goes to the root of nursing. This goes to why we're here. And actually, if you look at Florence Nightingale and what she talked about, the impacts on the environment, on people's health and well-being, you know, the importance of air quality, water quality, and the importance of, you know, light and air, etc. This really goes to why us as nurses and midwives are really this whole agenda actually fits with our entire purpose. So I'm really keen that we really galvanise the whole of our, you know, over 700,000 nurses and midwives in England alone now to focus on this. So if we move on to the next slide. I put these pictures up. You might have seen these before, but you know, this is a Spanish artist who, you know, I'm sure many of you will have seen this, but this was part of I asked our national lead Rodney to do a session with me, actually educated me about this, and these were two of the slides that were used within that, which from a Spanish artist, you know, showing all of the disposables that she had when she had breast surgery, and that's on the top right hand picture. And that's all the disposables there. And then obviously with my maternity hat on, that's all the disposables in the birth of that baby. And so you can see that this is a big issue in terms of the products that we use, but our ability to influence that. And that isn't about stopping using everything, but this is about how do we do this sensibly, sustainably, but also how do we influence, and nurses and midwives have a real powerful opportunity to influence around the design of things, products in the future, and how we use them effectively. So if we move on to the next slide. This is me, clearly in the middle there. This is a picture of me. I'm on a global health scholarship at the moment with the Florence Nightingale Foundation. And I'm using that as an opportunity really to connect with leaders from around the globe, nursing leaders, to be able to talk about many different issues. But actually, one of the things that has come up in conversation is the impacts of climate change, because some of those other countries are seeing those impacts already and really starkly. So you can see, you know, floods happening in increasing rates in places. I saw a presentation from a nurse, from a senior nurse in India a couple of years ago, which again sparked my interest in this space, which was seeing temperature changes and the impact that that was having on food supply, for example, and the impacts that that's having, therefore, on the health of their population. So this is something we are already seeing around the globe. So I would say to you, don't just think about the local impact, but obviously, you know, the impacts that other people are seeing already, because we have a responsibility not just to our local population, but the population of the planet. And that is a picture of Copenhagen, which I took actually last year. I was lucky to be able to go and connect with senior nurse leaders, so chief nursing officers from Europe, and chief medical officers, chief dental officers, and again, conversations around this. And particularly, the WHO is trying to make sure that we've got senior nurses at the hearts of government across the globe, across Europe. And you will know that we have our chief nursing officer, Ruth May, who's at the heart of government within the UK, but not every country has that. And therefore, you know, how do we use our influence and our voice to be able to champion health inequalities, prevention, population health, and the impacts of climate change? And obviously, you know, many of the countries are already seeing the impacts of migration, for example, and what that means in terms of the health challenge. And if you think about the potential impacts of climate change, etc., and what that will mean for displacement of people in the future, and what that will therefore mean in terms of our preparedness for changes in our populations, etc. So really important that we are at the hearts of government, we are talking about this, and that we are influencing this agenda going forward. So if we move on to the next slide. And this is a picture of some of our international nurses. And I put this up here because we've obviously done a huge amount, and you've done a huge amount to recruit our international nurses. So I would say this really talks to me about how do we tap into the expertise, the knowledge, the connections that our international nurses and midwives have, because again, they will be in contact with family members, with clinicians, with professionals in other countries who will be able to articulate and talk about the impacts of on their populations, but also then what action is being taken. So we've got an ability to share much more globally now the work that we are doing. And then I would also just reflect on the fact that we've also got in our nursing and midwifery population now, we've got many different generations of nurses and midwives. And so I'm really struck from the conversations that I have with student nurses, with newly qualified nurses. We've got a really climate aware group of individuals within our workforce now in a way that we've never had before. So how do we really use that as an opportunity to focus on things differently, and to galvanize that voice and that support to be able to improve the health of our populations and avoid the impacts of climate change on the health of our populations locally. So if we move on to the next slide. So one of the areas that I look after is children and young people. And I know you've got a session coming up, I think, later in the week on children and young people. But I wanted to, and you've also got a session on asthma in a moment, which is really important, particularly given, I think it's over about 1.1 million children in the UK experience asthma symptoms. We know the impacts around air pollution and other environmental factors. If you think about damp housing, for example. And so, you know, we are clearly have got a big challenge around the health of our children and young people. And you may have seen Core 20+5 for children and young people. So areas that we're focusing on health inequalities, so asthma, diabetes, epilepsy, oral health, mental health, and then obviously there are other areas that are being focused on much more locally. So again, really talks to why we've got our integrated care boards to really focus on that local population health, working with colleagues from local authorities, education, for example, on children, because and health visitors, school nurses. So these opportunities to bring people together to focus on reducing health inequalities in our population. But the other reason that I put this up is because I think one of the really important things is how do we listen to our children and young people. And we've got a fantastic group of young people that work with us on our Children and Young People's programme. And one of the key things that they consistently talk about is their concerns around climate change and the impact on health. And they articulate this in a way which I think is much better than the way I articulate it, because this is something that they have been educated in a way that I haven't been educated in, and I'm sure many nurses and midwives. So how do we tap into that voice of children and young people in this space? If we move on to the next slide, these are a couple of slides I've pulled extracted out of a presentation that they did to the Chief Nursing Officers Conference Summit at the end of last year. And they talked about, one of the things they talked about, what's important to them was climate change and what they wanted to see happen in this space. So, you know, obviously environmental stewardship, education and advocacy. They talked about community engagement, the importance of telehealth, and therefore reducing down the need for people to travel, for example. Much better education around this for health professionals and for patients and our public, and making sure that we are really supporting sustainable lifestyles. Now, our young people are our future workforce. So how, again, do we listen to what their concerns are? How do we listen to what their views are on this? So I would challenge everybody on this call to think about how are you connecting with young people, because actually they add a really powerful perspective and a really powerful place, not only for climate change, but also then around reducing health inequalities, because that is one of the big areas that they talk about consistently. So if we move on to the next slide. So I always like this quote because I think it's really powerful. Again, this isn't about kind of fear in the future. We've got an opportunity to shape the future, actually. So this isn't something that's sat over there that other people need to deal with. This is something we need to embrace at all of our levels. So at a leadership level for every nurse and midwife, working in our communities, wherever that may be, we have an opportunity to influence and change. And as colleagues talked about in the presentation before, you know, lots of great examples of work that's already going on in this space to make improvements. But if we move on to the next slide, you've already seen this, but I think it's really important to talk about. This is the strategic vision for nursing and midwifery. There will be a document that will be released any moment, I hope, in the next few weeks. We're just trying to get it over the final line. But again, this will talk about the professional strategic vision for nurses and midwives across England. And that's not only the NHS, but in social care, in the independent sector, etc. And what's great to see here is two things, really. Well, all of it is really great to see, but particularly around protecting our planet. That is one of the core themes within this. So championing sustainability, advocating for those most impacted by climate change, and also using evidence-based lower carbon care. But then also the important role of nurses and midwives in prevention, protection, promotion, and reducing health inequality. So you will see that as the second little bubble on the chart there. So that's obviously maximising our professional contribution across the life course, with a focus on prevention, protection, and the wider determinants of health. So this is one of the things I would ask everybody when this is published. Please find ways to use this as an opportunity to talk about these things with your teams. This is a really good vehicle to be able to do that. There will be a number of actions that are in here for year one of this programme. and vision, but please do use this as an opportunity to talk to the profession and your professional colleagues about their role in this and what actions every single one of them can do. So, you know, if you think about 700,000 people in the population of England taking action collectively together, we can make a really big, impactful difference for our patients and our populations and the planet. So if we move on, I think that might be the last slide. No, I've got some key messages for you to take away, so which I've put down here. So first one, really connect with the children and young people here and amplify their voice and perspectives. Not only is that great for being able to talk about this in a different way, but it's also a great way to connect with our future workforce as well. That focus on prevention, so making sure that we know that if we can avoid ill health, then obviously that is better for the planet, it's better for the individual. So really focusing on those areas and therefore working collectively together on that with our colleagues across local authorities, within charitable sector, etc. And then I can't emphasize this enough, but share what you're doing with others. So this is great you're doing this week. I really commend it because it's an opportunity to share with others some of the great work that you're doing in the Southeast. We don't do this enough, so let's do it more, and really don't be afraid to celebrate and shout out when you get some wins in this place. It's really important. So I'll hand back to you, Andrea.
Oh, brilliant. Thank you, Duncan. Again, really great presentation. I think, you know, getting the thoughts on the top of the shop are the big thing takeaways from your presentation. Well, influence, isn't it? Influence. We've got such a responsibility to be able to, as nurses and midwives, to be able to influence in this space. So that came out really loud and clear, and great that, you know, it's clearly in the strategy, as you said, and illustrates, you know, again, us as professionals being an enabler around all of this agenda. So protecting the planet, but also protecting our patients and ourselves and around all of this as well. Shout out CYP, you're right, we have got a focus session on it, but it's lovely to get that intro now. We've got that on Wednesday, actually, which again, another session I'll be chairing, so looking forward to that. And again, just sharing the good stuff that's coming out here. It is a real responsibility, again, to be able to share that and the learning. And I love the fact, you know, it's always starting off with Florence, isn't it? Do you know what? She was just, she was so ahead of her time. So ahead of her time. But great intro, and thank you. And those photographs that you shared, wow, they are really powerful, aren't they? Illustrating actually the usage. So we'll have to use those elsewhere if you don't mind. We'll probably, yeah, steal those with pride. Great, thank you so much, Duncan. I don't know if you need to go, but it'd be great if you could stay if we've got questions later. But that leads us really nicely now into our next session, which is Dr. Malcolm White. Hopefully you're on, Malcolm. Yes, brilliant. I can see you. Fantastic. So the floor is yours. Thank you so much, and thank you again for being here today. Thanks.
Not at all. And can everyone hear me okay? Seems fine.
Yep, we can.
I see a sea of thumbs up coming, which is great. So yeah, thank you very much for inviting me. My name is Dr. Malcolm White. My background is in hospital medicine myself, but I work for the charity Global Action Plan, which works to mobilize action on the systems that harm us and the planet. So it really, one of the big areas of focus that I work on is relating to air pollution. And that really ties into the green agenda, you know, extremely closely. It's inherent, essentially, because many of the actions that improve air pollution improve carbon and vice versa, essentially. So next slide, please. Now I've got a number of slides. I'm just going to try and rattle through them in the time which is allotted. But my sort of main purpose here is to help us all recognize that air pollution really does impact us all. And this is from our staff members in our hospitals, to our patients, to everyone who's visiting, very much everyone around the whole country. And it's not just an issue of the dense urban centres, though of course it can be worse there. Next slide. Good. You might be familiar with Clean Air Day. It's the UK's biggest day of the year in the fight against air pollution, and that this year is going to be on the 20th of June. So that's one to pop in the calendars. And you'll, if you're familiar, you may have seen that there's events that happen, usually organised by, say, health centres, hospital groups, trusts, but also schools and businesses, really anyone up and down the whole country. And it's a massive day in terms of that fight against air pollution. And I think coming into its 6th year now. And yeah, we're really looking forward to delivering that again this coming year. Next slide. So in terms of the scale of the problem with air pollution, I'll just very briefly go past the sort of international global scale and then bring it down into a more localized one. And unfortunately, it is the biggest environmental threat to health in the world. And this is recognized with key papers in The Lancet and many other places as well. And in terms of this graphic here, it's looking at the reduced life expectancy in terms of numbers of years and months based off of one type of air pollution, one of the really key ones called particulate matter 2.5, which really just means tiny little particles, blobs of liquid and other such detritus, which is floating around in the atmosphere mixed in with the air that we normally breathe. And the 2.5 is in reference to its size, which is 2.5 micrometers or less. And just from this one type of air pollution, you can unfortunately see that if you take the average population across the whole world, then it actually reduces the average person's life by over 2 years, 2 years and 3 months. So that's enormous. Now, one of this comes with different ways to interpret the data. So, for example, there are some parts of the world, like, say, Bangladesh and the Indian subcontinent and many parts of East Asia, which have a much worse air pollution problem for many reasons. And so the average there would be much higher, whereas in England, Wales, and Scotland is much lower. So it is still in the numbers of months in terms of the reduced amount of lifespan, but it is not quite as severe as the sort of nearly 7 years that you see in Bangladesh. So it's, really quite atrocious in some parts of the world. But what is very interesting to see as well is that the amount of funding which goes to this really serious problem is dwarfed by that of, for example, HIV/AIDS. Now, that is nothing to say that HIV and AIDS doesn't deserve every single penny of that funding, but it is just worth noting the disparity in terms of the amount of impact it has on lives lost and the amount of reduced quality of life years, quality adjusted life years. And that's more to say, let's have more funding to deal with this really serious issue of air pollution, please. Next slide. And yep, just very quickly, you can say that you look at the World Health Organization targets in terms of PM 2.5, and similarly for other main pollutants such as nitrogen dioxide, which we'll go into a little bit more of. The vast majority of the world's population lives in areas which exceed the WHO guidance. So it's really not just an issue of, people who live right in the middle of a city centre or anything like that. Next slide. Fine. I think just in the purpose of time, next slide again, please. Great. And I've already mentioned, indeed, the very serious issue that you have in some countries. So next slide. And then if we compare that to the UK, then you're looking at sort of 3 to 6 months, really, is the average that we're talking about there. Next slide. Okay, so bringing it down to a more localized level, it's still, despite that sort of comparatively small numbers in terms of the amount of years of life lost, it really is still a very big issue in the UK. And it causes over 40,000 deaths each year, a lot of which is due to cardiovascular disease, actually, and then conditions such as respiratory, but also we'll go into the wide range of health conditions which are impacted because of air pollution. And that really has a big impact on the NHS. Very much in terms of staffing and sick days, but also directly to the NHS in terms of, costs associated with dealing with the health impacts and the social care that comes with it as well. So that's well over, 20 billion pounds a year, which is an enormous chunk of our overall budget. And in terms of how that affects the front line of staffing, that really causes an enormous number of admissions each year relating to heart and lung disease, which, as we all know, every single one of these admissions is really impactful for the individual, but also it costs a lot of money for the service, and it puts a lot of strain on the service too. So that's really worth considering. Next slide. Fine. And so if we're looking at some of the sources of outdoor air pollution first, then there are many, and that apologies for the relatively complicated slide, but you can really see for each of these different sectors, such as energy or transport, we're looking at some of the main pollutants. So starting with particulate matter 2.5, nitrogen dioxide, sulfur dioxide, ammonia, and volatile organic compounds. I don't think everyone needs to remember all of the details about all of these, but suffice to say, you can really see, for example, road transport is the biggest source of nitrogen dioxide, and that's despite improvements in vehicles and their engines. And then for different types of pollution, we're actually noticing now that particulate matter, the biggest source in the UK now, is actually domestic burning. As if to say wood burning stoves. So that is a growing and worrying sort of trend in terms of air pollution in the UK. And that's not to say I blame every person who's ever had a wood burning stove, because people don't really know about this. It is unspoken about. It is sort of, and there's a lot of advertising that goes into the selling of these stoves and wood and the wood industry and all sorts of things like this. And so what I would encourage people to do is to try and burn less and as little as possible. But yeah, it's a really broad topic. There's lots of different types of air pollution, and there's lots of different sources, so it is complex. Next slide. So if we're looking at some of indoor air pollution sources, again, a pretty complex situation, but there are some similarities. When you burn things, you create nitrogen dioxide, and particularly say if you've got gas boilers which are inefficient, or with things, say there's leaking or anything like that in the system, then that can worsen the air pollution inside the home. Actually, gas burners, as in gas stoves, I think over the next number of years, we will probably see those decrease significantly in terms of new builds. Again, I'm not suggesting that people stop cooking or anything. You know, people have to live their lives, and many people don't have the powers to change the situation that they live in. And this is really a source of health inequality, as we'll see throughout this week. I think there'll be discussions around this too. Another source of health inequality is if people say live in private housing or say council housing or something like that, and the quality is not very good, so there's lots of damp and mold, and then this really enormously impacts in terms of young children and people with asthma and lots of conditions like this too. So suffice to say, there are lots of sources of indoor air pollution around the home too. Next slide. Fine. And yeah, I think I've covered this, but this really just points for particulate matter, really demonstrates the size of particles that we're talking about. So much smaller than the width of a human hair, for example. Next slide. Yep, and as we've said, road transport is one of the big sources of nitrogen dioxide. And just this example from Hackney in London, you can actually sort of trace where the major road routes are by the areas which have particularly high levels of air pollution, essentially. And we could talk much more about that, but in the interest of time, next slide. Fine. And so having thought about some of the sources of air pollution and that sort of global and national context, thinking about how it impacts the individual, it really does have a system-wide assault on the body, essentially. And for most people, or most of the impact, it's the inhaled route. So it has direct impacts on the respiratory tract, obviously impacting things like asthma and everything like that too. But once these gases and particles reach the end of the lungs into the alveoli, then if they're small enough, or if they're absorbed, then they can pass into the bloodstream, which is why it has such a significant impact around the whole body. In terms of that cardiovascular disease, that has direct, cardiac impact, but also the vascular elements such as strokes, clots, etc. And it's because it creates a generalized inflammation throughout the body, not in any way the same, but it's sort of recognizable compared to, say, diabetes or anything like that. The long-term elevated levels of blood sugar causes inflammation throughout the body, and that's why you see impacts throughout the body. And it's something that we see with air pollution too. Next slide. So my question is, does the NHS have a role to play? I think the answer is absolutely yes. And I feel that collectively we should be educating our staff and informing our patients. We feel and recognise that health professionals are trusted to deliver this health information, and that patients are not wholly responsible for the changes required. Fine, and next slide. So what I will say is I'm probably going to skip past some of these next slides, because essentially, in partnership with the Greener NHS Nurses and Midwifery Week, I'm delivering a sort of a full teaching session, so to speak, at 10 a.m. on Wednesday this week. And so I'll pop a link in the chat for that, and I'll put my email address beside that as well, just to see if, essentially, feel free to invite staff members along. This is as part of a project mostly focused in the Kent and Medway area for this year, which is actually very happily and coincidentally looking at maternal health. But at the same time, for this education session, anyone's welcome, for, across the whole of the region. So that's perfectly, feel very welcome to that as well. Yeah, and so I will probably just ask next slide for the next few. But you can see here that there are lots of benefits, and there are lots of examples of how we can actually encourage our health professionals to, and if we stop at that one for a second, thank you. So yeah, there are lots and lots of ways in which we can encourage our colleagues and our healthcare professionals to speak to their patients on air pollution. One resource, for example, from the GAP website, which is part of DEFRA funded originally, we developed lots of training videos with Sir Stephen Holgate and other experts in the field. We have lots of free resources, such as leaflets, posters, slides you could use to educate your colleagues, and all sorts of things like that, which are essentially, you can find them on the GAP website, but the link, the web address is there at the top as well. Next slide. Yep, and just a few examples of those as well. So please keep on clicking through. Thank you. And yeah, stop there for a second. So does the NHS have a wider role to play? I absolutely feel that it does. The NHS, through its actions, unfortunately creates air pollution. And we saw that road transport is one of the big areas in terms of outdoor air pollution, and the NHS has about 5% of the total road miles driven in the UK. So it is a big contributor. So we really feel that the NHS should be leading on this, and in many ways it is, absolutely. An impressive electrification of the fleet, all sorts of very good steps like that moving forward, but always we want to drive further and go faster. I think drive was the wrong pun to use there. Anyway, so yes, so GAP have been working with the NHS directly. We have documents such as the Clean Air Hospital Framework you might have heard of, or the more recently developed ICS Clean Air Framework 2, at which we can work at the trust level or at the more regional ICS level in order to help the NHS tackle air pollution at scale, which is the sort of way that we want to tackle it. Because if you bring in the local authority, if you bring in academic groups, if you get everyone around the appropriate tables, electronic or otherwise, then you can actually tackle some of these issues, which is otherwise really difficult to manage, because the NHS cannot stand and be like, could you change that bus service, please? It doesn't really have the clout in the right spaces. So bringing everyone together can make a lot of those changes that we'd like to see. Next slide. Yeah, and I think I will almost just wrap in a second and go to nearly the last slide. But even just to point out, Professor Sir Chris Whitty has said that the NHS is aiming to reduce its contributions to air pollution by 50% within a decade, which is a really strong commitment. and that was as part of his Chief Medical Officer's report in 2022, which is a really key document, and the first one that he did post-COVID was on air pollution, so it really highlights the issue. And so I think I've got 2 or 3 more slides to sort of scroll past, please, if you don't mind, and then I've got one which has the sort of final areas to go for. And if you stop there, thank you. So my key messages: air pollution seriously impacts our health, worth noting, worth knowing about, so that we can educate our population. There are things we can do to avoid polluted air, reduce your exposure, and things that we can do to reduce the amount of air pollution that we create, both at the individual, localized, and sort of regional level. And overall, not underestimating the power of healthcare professionals in calling for change, which is something I speak much more about in the training, which you can deliver much better across an hour. But I was very happy to give a very quick rundown on that over the course of 10 to 15 minutes. So I really appreciate having the time to do so. Thank you very much.
Well, thank you, Malcolm. I have to say, what a illuminating and informative set. I've learned something from your presentation today. So, it goes to that point where you mentioned that, it's the education around and raising awareness around clearly the issues here, isn't it? And I think what you did bring to life is clearly the macro influences here. I hate to say it, I have got a wood-burning stove. You've now given me food for thought around my usage around all of that, particularly my husband's. But anyway, but also then the impact that all of that has around the individual, and given that global context and the national. Just really, really good stuff, actually. So thank you. Thank you. Thank you so much. We've got some time, only like 4 minutes left for questions. I'm really happy for people to put in the chat any questions that they have, and we will get back to you on those. We have got some take-home messages though, that we've just put up here following our session, for people, and we are sharing the slides, aren't we, guys? Is that right? Yes, so that's really great as well. So you'll just see up there that I think the big thing for me is we clearly, as healthcare professionals, have got a huge influence around this agenda. There's no two ways about it, and we can definitely influence around the impact on this as well. This session today is certainly, I think, if anything has set the context and the call for action, it has been this session, hasn't it? I think on what we've heard, and so this gives us a really good platform now to be able to take forward our next sessions that we've got planned for the rest of the week. Huge thanks. We couldn't ask for more, I think, from this first session. It's been truly really informative and valuable. But happy to take any last any questions at any points anybody wants, any reflections actually anybody wants to highlight on the session today. Really happy to take those if anybody wants to put their hand up or feel brave enough to do that. But
and one question in the chat, Andrea.
Is there? We've got Nick as well. I don't know if Nick wants to come in.
No, I put the question in the chat.
Oh, thanks, Nick.
Very much. Don't worry, you don't have to see my face now. It's fine.
Okay. Question: thinking about this in practice, what are the main barriers to them? Yeah, it's a good question. It's quite it's a broad one as well, isn't it? Again, one that we've got to, it's food for thought, isn't it? And I think, following these presentations, I think it really helps with thinking about our own influences, our own practice around this. Jackie, did you want to come in?
It's really a comment, and that is, well, first of all, it's been a fantastic session. I guess it's a personal bugbear, but nevertheless, it's something that I see all the time, certainly at the trust where I work and at other trusts as well, and that is about smoking. And despite the signage that I see, not only, like I said, at the trust where I'm based, but other trusts, health organisations, smoking seems to just continue regardless of policies in place, regardless of any notifications. Can something be done? So it's a rhetorical question, not expecting anyone to give an answer this afternoon, but can something be done to ensure that NHS trusts are completely smoke free.
Yeah, it's a really good point you raised, Jackie, and one that's quite emotive, isn't it? And having been my previous job as chief nurse, seeing patients, smoking, and staff actually, and then challenging not so much the staff but patients, you can actually receive quite a bit of a backlash on that. So it's a really tricky problem, but and not just patients and staff as well. Malcolm, any reflection on that to come back with it? We have clearly got policies in place, but it's the implementation of these is really tricky, isn't it?
It is. I'm happy to come in. So I think in the one hand, I completely agree that, having staff and patients exposed to smoke in the place that they work or they're trying to get better when they're sick is like just completely unacceptable. I'm going to be slightly controversial, to be honest, and I think you're playing a losing game in the sense of expecting a completely smoke-free, as in having any patient who comes in who smokes never be able to smoke like during the entirety of their stay. Like some patients are in hospital for weeks and months, and that's not to say that we shouldn't give them all the support towards stopping smoking or anything like that. I worked as a respiratory physician, I completely understand the implications of it. But what I would maybe say about it is that despite all of these policies, which are very much, aiming towards smoking eradication on the site, I don't know, if it feels like sometimes we lose balance, and if there was some form of facility in which a space in which smokers could go, in which it was like contained, or I don't know.
It's tricky.
It's
very
tricky.
It's not a fully boiled thought, really, to be honest.
It's not. But it's a really good point, Jackie, because I think, particularly with the, clearly the ambition being that with, sites are smoke free, it's easier said than done, isn't it? And it is around human behaviour, isn't it? And changing that human behaviour, which is why we're here today, I suppose. So more to come out on that. I think the introduction though of the smoking champions that we've got, within trusts now, and trying to really target patients in particular when they get admitted as smokers to try and help them quit smoking is a good move. But this all takes time, doesn't it? I think is the key. Alrighty, I'm just very conscious of time. Can I say a huge thank you to all of our presenters today? I think again, honestly, we couldn't have asked for better presentations to really set the scene and set this week off on such a great footing. Clearly, there's a lot of enthusiasm around this, and a lot of dedicated people really working hard. And I think, we can only go in strength, I feel anyway, from today's session. Hopefully you found it, for those of you who've been on the call, found it valuable. It's really great to see a really good coverage as well from across the region, and hopefully we will have more people joining us for our next session and our next focus sessions as well. So without further ado, just wanted to say again, huge thanks to everybody. Thanks to our presenters. Thanks to those that have attended. And the look forward is to tomorrow's session, same time, same place, where we're looking at nursing care pathways. So be there or be square is what I'd say. But look forward to seeing you in the rest of the week. And I'll be chairing the Wednesday session. It's Kay Wilson tomorrow. He's our regional chief midwife. So thanks again, everybody. Take care. And see you on Wednesday. Thank you.
Thank you.
Thank you.